Hello there. Welcome to my show. COVID-19 update by Heerak for November 27, 2020. And we are headed to 2021. Jingle bells, jingle all the way. What fun it is to ride to sleigh. Jingle bells, jingle all the way. I'm sure you love to sing Christmas carols, you know. I remember going from door to door Christmas caroling with local church in uh, Falls Church. We had a lot of fun just walking around Falls Church neighborhood, singing Christmas carols. And there were quite a number of us, and we did the Christmas caroling, and afterwards we had pizza. It was a lot of fun, you know. Yeah, we're part of a community. Falls Church is like a stone's throw away from where I am right now. Um, and yeah, it was, houses in Falls Church are really big, compared to houses in Arlington, At least that neighborhood, the houses were like humongous. And it's only like a few miles from here, like two miles or so. What a difference, Nice houses, It was like, whoa, and decorations were nice. I'm curious which house will have the best Christmas decoration this year in that neighborhood of Falls Church. Um, yeah, you remember me singing in front of your house, right? I always like stood in the front with, you know, uh, the choir director and the pastor. you know, I like standing in the front, and there were some nice people from the choir who stood in the front too. So yeah. Yeah, so today is National Electric Guitar Day. Some of you play electric guitar. Some of you like listening to electric guitar. Some of you like songs with electric guitar in them. Hear the song? Has it happened to you? you know, I know some people who it happened to. Guys can be like dogs. you know. Yeah, what can you do? Guys are guys. That's why you gotta get that ring on the finger. Yeah, once you have the ring on the man's finger, you own him. You booked him. He's booked. you know, being a smart woman, make sure she gets the finger on the guy's hand. Because before that, you have no deal. Guy can walk anytime. And you guys do, as you know. Probably over 50% of the guys walk, If you're in a long-term relationship without a ring, or with that, yeah, without a, wedding ring. Yeah, smart woman gets that ring before too late, But, hopefully you're a smart person. But yeah, they say this is one of the most, popular songs among young people, especially singles. If you're single, you know, um, you're searching for that, significant person to spend the rest of your life with. Um, and obviously, you may have had bad experiences, made bad decisions in life, so you can identify with, songs that kind of approximate your experience or is actually like your experience, you know. Yeah, so Christmas is coming. It's 1 month away. I don't know how many Christmas parties there will be, unfortunately, Last Christmas, I went to like the Christmas party at Washington, D.C. Young Republicans. They threw, it was really nice. Christmas party. Um, and U.S. Congressman Andy Biggs was there. And he's a good guy. I like him. First impression is always really nice. And he's doing a lot of good things in Congress. And I went to Arlington Falls Church Christmas party. That was a lot of fun. I was hoping to go this year as well, but it stinks because because of COVID-19. I don't think there will be any Christmas parties. And it's always fun like dressing up like in your ugly Christmas sweater or dressing up like Santa or whatever, and you know, uh, it's always fun. There's like fun music, fun food, and you hook up with people that you like. And I'm single. I've never been married. I don't have children. So yeah, who knows? You can always meet like the love of your life in a Christmas party. A lot of people do. That's like Christmas parties are a good opportunity for single people to meet someone. But unfortunately, this year, if you're single, you're out of luck because from now until December 25th, there will be tons of Christmas parties, especially in Washington, D.C. area. I mean, you can go to, like half a dozen Christmas parties, and then you find the love of your life there. And it's like that in every metropolitan area, like Chicago, New York, Los Angeles, San Francisco, Atlanta, Georgia, Charlotte, North Carolina, Miami, you know, but now you're not going to have that opportunity to go to a Christmas party and meet somebody who may, who you can spend the rest of your life with. It's like a sad time of the year for singles people, who are not married, and unfortunately, some people may become like spinsters because of COVID-19. It's a really sad scenario right now, you know. Yeah, if you're married, you're lucky because you're already married. You don't have to marry. You don't have to worry about being a spinster the rest of your life. you know, and if you have children, you have children to, keep you happy during COVID-19, because like right now, households are kind of socializing within households if you want to be safe. And so if you're already married, you have your husband, your children, that you can socialize with, and you can do a lot of fun things with your family. It's like almost like an extended family vacation. You can make it like that, if you're a creative person. So for those who are married and have husband and children, and obviously everybody have to work at making the marriage happy and family happy. It's not easy work, right? Because people have personality conflicts, and you know, but as long as you're kind of working hard to make everything work, your marriage work, your family work, I mean, this may be the best time of your life for you. You know, you can spend more time with your children, with your husband, maybe have a couple more children. It could be the best time in the world for married families who want to spend more time together. So not everybody is suffering right now. I know, like in the media, people are saying people are suffering. Singles people are suffering because you can't go on a date, or it's hard to go on a date. Um, there aren't any Christmas parties, and every weekend there's a lot of fun parties and games, and escape room, and all kinds of things you can do for singles, and none of them really, it's hard to find those now. So it's like help for singles because like they're like isolated, and they risk getting COVID every time they go on a date with a stranger, right? So, some people think it's worth the risk, but people take risks all the time, but there is that risk. Whereas if you're married and have children, there is really no risk as long as you're kind of socializing within your immediate family, father, mother, children. Or if you brought your grandparents to live with you, or your children's grandparents, your parents to live with you, then it's your mother, father, you and your husband and your children in a happy bubble, you know? And you're safe as long as you don't bring in like strangers into that bubble, you know? So it should be the happiest moment for some families. Life is what you make it, so make the best of it. COVID-19 can be forever. Um, COVID can last until for 10 more years. It's definitely possible. It could go further than that. As you know, HIV virus has been here ever since we discovered it, and it hasn't gone away. It kills hundreds of thousands of people every year. Um, and hepatitis C virus is the same. It has been here since we discovered it. It hasn't gone away. Hepatitis C virus and HIV virus, they do not have a vaccine. Obviously, people want a vaccine. Scientists have been working for decades to develop a vaccine, but there are no successful vaccines. Unfortunately, COVID-19 may be that way. vaccines may not work. Um, that's always a danger, when you're rushing a vaccine. So let's see what happens. Everybody knows there are side effects. The question is, how bad is it? There's debates about that. Um, yeah, let's see. Once you administer vaccines, if people start dropping dead from side effects, then it's really bad. Let's see. So there are two things you gotta watch out for with the vaccine. Number one is, does it work? Number two is, are there side effects that harm or kill? So that's something that will be seen in the months to come once the administration of vaccine is done. So yeah, it's Good Friday today, so not everybody's reporting COVID-19 cases and death because Thanksgiving everybody had off. Good Friday, not Good Friday, Black Friday today. A lot of people have off from work. Um, so people don't want to be working over the Thanksgiving holiday. It's one of the eating gluttony holidays. You eat and then you're like recovering on Friday. When you wake up, you go shopping. So not all the numbers are in, but the numbers that are in show that we have 1,351 people who have died in the last 24 hours. So right now, confirmed death is at 264,764, and the cases are at 13,072,584. Probably deaths are over 2,000. But right now, as I said, not all the counties are reporting because every county in every state have to report, right? And a lot of counties are not reporting on Thanksgiving or Black Friday because they're taking a couple of days off to celebrate Thanksgiving with the family, do stuff with the family. And so it's probably over 2,000 just because it's holiday. But yeah, but it's bad because the numbers that have come in show that at least 1,251 people have died in the last 24 hours. So that's bad. Uh, you know, I was going to bachelor in Poland, continue that, but I was thought, well, Thanksgiving is like kicking off Christmas Day, and Black Friday is like Christmas gift shopping day. So I was like, maybe I'll do another Christmas theme today, because hey, who doesn't like gifts, right? Everybody likes gifts. For those guys out there, if the girl says she doesn't want a Christmas gift, don't believe it because she wants a Christmas gift. She wants you to be the Santa. I mean, she could be a Santa too to you, but you know, uh, it's everyone loves Christmas gifts, right? Yeah, so that's just people like gifts. People like to receive more than give. That's just the way life is. And so make sure you get your gift to for everyone because everybody loves receiving gifts. It is Christmas. Santa is timeless for a reason. Who doesn't like receiving gifts, right? Yeah. So yeah, and I was like, turns out, like, I like receiving gifts too. You know, um, yeah. So what you're seeing there is a Christmas dinner, formal hall at Jesus College. So you're looking at the dining hall of Jesus College, where Jesus College Cambridge members, and I'm a permanent member of Jesus College Cambridge. So, Jesus College Cambridge members have their meals. And that's a formal hall, so you see everybody wearing tie and bow tie. As Cambridge is a posh university. It's like brings together nobles around the world, royalty around the world. So they keep up traditions to maintain that elite uh, status. And if you see James Bond movies, he's always wearing like formal wear. I loved it. I love that about England. It's so much fun to like dress up and party. It's like every week we do that. We dress up. So I really love Cambridge. I am a member of Jesus College, permanent member, and our emblem is right there, our coat of arms, the three chicken. And I love chicken, so it fits me fine. Jesus College has a lot of famous alumni because it's like over what 500 years old, or around 500 years old. So our famous member is Thomas Cranmer, who created the Book of Common Prayer for the Anglican Church, which is also the Episcopalian Church. So if you drive by, like in Falls Church, you have the First Anglican Church, right? And you have Episcopalian churches. They use the Book of Common Prayer, and it was created by Thomas Cranmer of Jesus College, Cambridge. Cambridge. So I'm proud to be part of that, important tradition. We have a very beautiful chapel. Um, and I think I've shared the photos of our chapel with you. We have a beautiful chapel. And Christmas is like the best at Cambridge because it's a Christian nation. You have the Queen, the Christian monarchy, and everybody loves Christmas in England and it's celebrated publicly everywhere. Uh, Not kind of like in Mexico, right? Everybody celebrates Christmas publicly. It's a Christian nation, and so it's a great time to be in England during Christmas time because it's such a Christian nation. And they say Happy Christmas more than Merry Christmas in the United States. We say Merry Christmas, but in England they say Happy Christmas. So Happy Christmas to all the Jesus College Cambridge members. Uh, yeah, there are a lot of Jesus College members. They're in important leadership positions all over England, Scotland, Wales, Northern Ireland. They hold top leadership positions in every industry: business, politics, law, medicine, and so you know who you are. You're probably watching this show. Many of you know me. Some of you have danced with, fond memories. And so, yeah, we always have a fun time. And, in England, you wear this like paper crown for Christmas parties. Uh, and I guess that may not have been a formal hall for Christmas, but it was during Christmas time, so you could wear Christmas stuff. But they have a special Christmas formal hall, so that might have been a formal hall at the time of Christmas. So some people are kind of celebrating, but during Christmas formal, everybody wears that yellow, green hat. So I guess to the right you have me in the Christmas formal hall, but like you bring a non-Christmas formal hall during Christmas time. Some people come in with Christmas stuff. It's the festive season. So it might have been like a week before Christmas formal hall or the week of Christmas formal hall because they have several formal halls during the week. And that's what I love about Jesus College. I tried to go to every single one, so I love them. Um, I had a lot of friends at Jesus College. I was very popular among undergraduates and also graduate students. And it's like that, at Georgetown University, where I did my 2-year master's in clinical nurse leader from 2018 summer to 2020 summer. I graduated with 24 other clinical nurse leader graduates on August 24, 2020. I was very popular with graduate students. I was very popular with undergraduates. That's why I became uh, vice president of the graduate student government, Grad Gov, from May 2019 to May 2020. And our official graduation is in May. Although, I was in a special intensive program, nursing program. So Master's in Clinical Nurse Leader program went to August, but technically the graduation ceremony is in May. So the government goes from May to May, graduate student government. And there are like 9,000 graduate students at Georgetown, far more than undergraduates. And I was the vice president because I'm popular among graduate students. Graduate students in law school, medical school, nursing school, school of foreign service, business school, school of public life. They all know me. I'm very popular, so that's why I was the vice president. Number two. uh, yeah, so for a whole year, I had a lot of fun serving the needs of my constituency. And I'm the fun guy in GradGov executive board. So I'm the one who's at the funnest, you know? Um, so people like the fact that I'm fun. Because you need a fun guy. I played for the title and won. I was the vice president for a year from May 2019 to May 2020. Yeah, it was a lot of fun, you know. I shared some photos with you about, from my, from the boat cruise, right? You saw those. And we had the holiday party. I shared photos with you from there. We had a lot of fun, you know. Where would Georgetown University graduate students be without Heerak Christian Kim, the vice president of Grad Cup, to give them fun, you know? And right now, Georgetown University is 100% online. Georgetown University 100% online for undergraduates. Georgetown University is 100% online for graduate students. It's been that way since August from the very beginning. Because I lobbied for 3 months to save lives of Georgetown University students, professors, staff. I succeeded. And yeah, and I was the executive board member of Hoyathon. It's a dentathon to benefit Children's National Hospital. And I was the only graduate student in the executive board. Everybody was undergraduate. They actually created a position for me because I was the first graduate student, executive board member in the history of Hoyathon. So, yeah, see, I'm making history all the time. I'm very popular with graduate students and undergraduate students at Georgetown University. Just call me Mr. Hoya. Mr. Hoya. Yeah, I see like Georgetown University medical residents and interns at Virginia Hospital Center. And I'm like, hey, you remember me being your leader from 2019 to 2020? You know what I'm saying? I gave them fun. I gave them a hope while they were studying like a dog at Georgetown, as the vice president of Georgetown University Grad Gov. So, I have a lot of posse, a lot of followers and loyal people all over Arlington County, Alexandria, Falls Church, and Fairfax County, Washington, D.C., Montgomery County, St. George County, Howard County. Yeah, this area is mine. Yeah. But anyway, you serve people's needs, and obviously, I was there to serve as a public servant. But people appreciate it, and some people are willing to give their arm for you. You know what I'm saying? So I'm happy as a clown, being a public servant, helping people. Whenever I can. When I was at Cambridge University, I was a leader too. I'm a leader wherever I go. I ran for academic officer in the executive board of Cambridge University Student Union. And I won in a university-wide election of undergraduates and graduate students. So something like 20,000 students participated in the election. I campaigned and I won. And so, yeah, so I was academic officer of KUSU, uh, Cambridge University Student University, KUSU International. So, I've shared photos of that. And so I was very popular among undergraduates at Cambridge and graduate students at Cambridge. I met their academic needs. So yeah, so yeah, you see me with Martin Wood, my best buddy, in the photo there, and next to other side of me is the Prince of Freiburg. We had a lot of fun. Martin and I were the best friends, but Prince of Freiburg, Prince of Macedonia, Prince of Georgia, in the former USSR uh, Republic. We're like a social circle, so we did a lot of fun stuff together. But Martin Wood and I were the best friends. He's like Scottish royalty. So one time we went to this party at King's College, Cambridge. I don't know if you've heard of King's College Choir. They're kind of famous around the world. And so we partied with a couple Muslims. you know, Martin Wood, he's a royalty, and he has close connection with royal families of Middle East. Because these royalties connect. So Martin Wood, he connects with royal families in like Saudi Arabia, United Arab Emirates, Qatar, you know, I guess there are a lot of these royal houses in Middle East. So he's a royalty, so he's a European royalty. So he hobnobs with a lot of Arabic Muslim royalties. So we sometimes party with Muslim royalties or nobilities. So you see Martin Wood with one of them there, and then and, and then I'm with the girl from Iran. Yeah, she's like an important. family daughter from Iran at Cambridge studying. And it was fun to party with her. Iran in the house. Iran in the house. I mean, she was kind of not very religious. Um, so I guess that's why I chose her. And she was prettier. I mean, I said, Martin, you go with the woman who's more, uh, conservative Muslim. I go with her, the one from Iran. So we had a lot of fun. But both of them were actually really fun. So you know, Muslim women love me. When I was at Cambridge, what can I say? When I was in Israel, Muslim women loved me too. Like Palestinian women, there were Muslim women in Israel, Israeli Muslim women, Israeli citizen Muslim women. They love me. Um, I am transcendent in terms of religion, ethnicity, race when it comes to women liking me. I don't know why, but that's always been the case. Whichever country I go, elites, women of that country like me, and even women who are not elite like me. So I guess I'm like transcendent. Transcendent. I transcend race, religion, and ethnicity when it comes to women liking me. What can I say? So we partied with a couple Muslim women. It was a lot of fun. Yeah, the King's College parties are not as fun as King's College parties, but they're okay. I used to go to a Queen's College party because there was a royalty I really liked. I think she is a countess in where was that? She's like she's amazingly beautiful. She's English. She's I think like royalty, and she's like I guess she's called countess. It was in Cambridge, it was Queen's College, Cambridge, and she would come down generally like middle of the dancing. Like the dance would kick off, and then she'd come down with her entourage. She's amazing. I did dance with her a few times and had fun with her. Um, so, but Queen's College, they generally throw the best parties, I think. But Jesus College, we're close. I mean, we're very close to them. So, if I had to rank different colleges where I partied, I would say Queen's College is number one at Jesus. When I was there, at least. It could be different now. But yeah. But she's like, when I see her, she reminds me of like Cinderella, or she's like, I don't know, even when she dances to hip hop music, sometimes we would dance to hip hop music together. She has like a, grace about it. I wonder if she went to finishing school. She's very, she's amazingly pretty. But anyway, you know, yeah, um, yeah, Asia has royalty too. Like in Thailand, there's royalty. Several other countries have royalty. I mean, Japan has royalty. These royals all connect. So when I was in Cambridge, there were Japanese royalty that connected with the English royalty. So yeah, I mean, it's kind of a small, like, elite group, I guess. Yeah, so in Asia, India is number one for COVID-19. It has 9,309,787 cases. And death is at 135,715, so 1% death rate. Indonesia is number two with 522,581 cases and 16,521 deaths. So Indonesia's death rate is rising significantly. So it's at 3%. It was much lower than that before. So Indonesia needs to worry. Bangladesh, but not as much as India. India really needs to worry. They're probably going to have millions of deaths by June 2021, which is sad. India is so crowded, and it's such a vulnerable country because not all villages have healthcare systems. I want to go to India and create healthcare systems in like cities and villages where there are none. So that's one of the things I would like to do. Hopefully, I could find someone who shares my vision. Maybe I'll marry a woman who shares my vision, for the world. A woman who wants to help create healthcare access and systems in third world countries and in poor areas in America, both in, like rural areas as well as inner city. Maybe I'll find a woman who will kind of share that vision. I mean, there were some British women and royalty who kind of had that, desire. Unfortunately, I didn't end up marrying any of them. Um, but let's see where God has a purpose for everything. If I married one of them, yeah, royalty or nobility, I would probably have settled down in England or whichever country. If I married a royalty from Norway, I would probably settle down in Norway, and I would have done what I wanted to do from there. But I probably would have just stayed as an expert of Jewish studies, as a teaching if I were in England at Cambridge University or Oxford University. If I went to Norway, I probably would have taught at University of Oslo, whichever country I'm in, with the royal whoever I marry or noble. That's probably what I would have done because I'm a leading expert of Jewish studies around the world, and I could teach at any university. I'm an expert, a leading expert. Um, but God has His will, right? And I guess for some reason God has guided me to where I am. Although my plan was to become world's leading expert of Jewish studies and maybe teach in one of the leading expert universities like Harvard in America or University of Pennsylvania, Center for Jewish Studies, or University of Oxford, Cambridge, or University of Paris, Sorbonne, or Heidelberg University or Berlin University. That was my plan. Or Israel's Hebrew University of Jerusalem. So that was my plan, or Stanford University, which is doesn't really have a Jewish studies. So if I teach there, I'd have to build it up from scratch. I mean, they do have Jewish studies. It's not very good. Um, but or Duke University has pretty good Jewish studies. One of my teachers is the leading tenured professor of Jewish studies there now, Mark Rattler. They recruited him away from Brandeis University, so he's there, and he's one of my teachers. Um, and so he's like the main Jewish studies expert at Duke University now. He's Jewish. He's like modern Orthodox, conservative Jewish Jew who's a professor. Yeah, I know all these important Jews around the world. But anyway, hi Professor Bretler, Mark Bretler at Duke University. you know, but so if I married the royalty, that's what I would have done. But God had other purposes. And I became a nurse. I'm a registered nurse in the state of Virginia. I'm a registered nurse in District of Columbia. And my license for registered nurse in Virginia is a multi-state license. So I can practice as a registered nurse in like 30 states. In every state, practice of nursing in the United States is controlled by the state. So you have to get a new license every time you move. But there's this multi-state license that allows you to practice in like 30 states, which are members of that license. So I have that. Um, so I guess God knows that I'm the Leonardo da Vinci of 21st century, and maybe God thought, you know, I shouldn't confine myself to Jewish studies because I am the Leonardo da Vinci of 21st century. God wanted me to help people in other ways as well. So I'm still doing a lot of Jewish studies, research, and publication. I went to University of Poland or University of Warsaw to present my expert leading research on Jewish studies. I was invited to do that. That's why I went to Poland in 2019, August. And that's why I had the bachelor in Poland. I was there actually for work. God makes pleasure and work and dated over 15 women. I was there for like 10 days or less. And yeah, that's where bachelor in Poland came from, I mean, multitasking, yeah. But anyways, I am keeping up with my Jewish studies. Leading experts of Jewish studies around the world still know me and respect my research. I'll continue to do that. Think about doing like nursing in ancient Israel, nursing in New Testament time. I'm thinking about kind of combining things, and then I could present a paper in a nursing society for history of nursing, and then I could present a slightly altered form for Jewish Studies Conference, and maybe American Association for Jewish Studies Research, AHAR, or AJS, Association for Jewish Studies, which I'm a member of, card carrying member of. So yeah, and over 90% of the members are Jewish. They teach at, they're professors of Jewish studies in American universities, like a yeshiva university, and Jewish Theological Seminary. So I remember my colleagues. I call them my colleagues. But anyway, yeah. But God had his other purpose. He wants to help humanity through me. What can I say? When you are given much more expected. So God has paved the way for me to acquire nursing expertise, professional license. I've submitted proposals for several nursing conferences already. I presented like I think I submitted like something like 4 proposals. It may be 5. I submitted proposals for annual conferences. One of the conferences is in Singapore. It's an international conference on nursing research. So I submitted a paper for that, a proposal for that. If it gets accepted, I may fly to Singapore if we're allowed to. It's like next summer, in 2001 summer. Uh, I I submitted a paper for national nursing conferences in several, which are going to be held in different states. And there are several different nursing organizations that help for their annual conference, national conference. So yeah, I'm going to be helping you, nursing researchers, paving the way for what we need. And there's um, ANA, American Nursing Association, and we do a lot of political activity in nursing. ANA, American Nursing Association. So I'm a member of Virginia 8th District. Uh, you know, uh, American Association for ANA, Association, American Nursing Association. The state chapter is Virginia. I'm a member of national and state. So I'm in Virginia's 8th district. So, I'm doing things in Virginia's 8th district and in the whole statewide of Virginia and nationally, focusing on how we nurses can help in the time of COVID. So I submitted a proposal for American Nurses Association. They have this, it's not, what do they call it? They don't call it a conference. It's like you prepare like political briefs to present at Congress and Senate, lobbying efforts. So there's something that we do in the area of COVID. So I presented something in that area. It's like policy. They have a policy division, so they're trying to formulate a policy statement. So it's not technically a conference of nursing research. It's more like policy. I guess like you're being an activist as a nurse to push a healthcare policy that you feel are needed in a particular time. Right now, COVID is the biggest thing. So I submitted a policy statement, and research that would help with formulating the kind of nursing policy that would represent 4 million nurses in America uh, at the U.S. Congress, the U.S. Senate, to try to formulate a national strategy in COVID from a nurse's perspective. So I put a proposal in for that. Let's see if it gets accepted. Then I can go ahead with whatever I propose. So I'm an expert. I presented academic papers and education conferences. As you know, I'm a licensed teacher in state of Virginia, Washington D.C. South Carolina, state of Tennessee, state of Alabama, state of Georgia. If I teach one day, my professional license comes. So I have all the qualifications submitted and authorized. But Georgia requires that you physically actually teach a day in Georgia, state of Georgia. So yeah, so I presented papers at academic conferences on education. My focus is on inner city public schools with focus on Black education. Like inner city public schools, which are 100% Black population. So that's my expertise, area of expertise. I received my teacher certification education at Virginia Union University, which is historically Black colleges and universities. So I am a certified expert in education. What can I say? I am the Leonardo da Vinci of 21st century. And education researchers need my research to direct their goals for the next 10, 20 years in the area of urban education and Black education, and specifically Black education. So yeah, I do what I can. I have this, you know, um, leadership that God has given me. I am the Leonardo da Vinci. So I try to solve the world's problems in different areas. Yeah, so you're so lucky I exist in the world. Why would this world be without Heerak Christian kids? I mean, tell me that. Where would this world be without Heerak Christian kids? Would your world be the same if your Christian kids did not exist in your life? You know, you know, um, what can I say? It's 7 is up, right? Yeah. So, yeah, India is number one, Indonesia is number two, Bangladesh is number three. So it's 458,711 cases, and deaths are 6,544, and Philippines is number four, uh, 425,918 cases, and the deaths are at 8,255. So Philippines is in a problematic mode. The death rate is rising. So you need to worry if you're in the Philippines. It's at 2%. Pakistan actually was number two and it dropped down all the way to five. So Pakistan is doing really well. 311 cases, 7,897 deaths. So, yeah. Christmas at Jesus College. So, yeah, as you know, I am a candidate for U.S. Congress in Virginia's 8th District for November 8, 2022. So I submitted my candidacy to Federal Election Commission, so they know I'm running for 2022. I registered, as an independent. As you know, as I said, I'm contemplating running for Republican primaries. Um, you know, uh, we'll see. Let's see. I like the Republican Party. I've been a Republican all my life, basically. But God led me to run as an independent for 2020, although things kind of got messed up because of COVID. But let's see. Republican primaries will be like in March 2022, so I have still time to decide. Um, so let's see what happens. So COVID-19 world, U.S. at COVID-19 breaking point. So that's the title for today. Um, so U.S. sets record of more than 90,000 COVID-19 patients in hospitals, and healthcare workers. One situation is dire. So just like a week ago, maybe a week and a half ago, it was like a 70,000, around there. So it's been like spiking up. Like, we're talking about what, 25% growth or so. Um, so which is bad, which is really bad. But yeah. So this article in Market Watch by Tara Linan. Um, so you can see like the article stating the U.S. set a fresh record of hospitalizations with the coronavirus illness, COVID-19, on Thanksgiving Day, with more than 90,000 Americans in U.S. hospitals, the most since the start of the pandemic. The U.S. counted at least 103,116 new cases on Thursday, that's Thanksgiving Day, yesterday, according to a New York Times tracker. That's below recent daily tallies that have come closer to 200,000. But some states did not report their numbers for the holiday, for Thanksgiving and even today, which meant the true tally is likely higher, it's probably around 200,000. Case numbers have been rising across U.S. in recent weeks, and healthcare workers are reported to be exhausted and stressed as hospitals and intensive care unit beds fill. And it's going to happen more because there's like millions of people flew for Thanksgiving and flew back. So they probably carried COVID to wherever they were going, some of them. and they probably brought back COVID from wherever they were. So we're talking about probably like 200,000 cases going to 400,000 cases in a couple of weeks or so. As you know, I'm predicting that probably like 10,000 people will die per day in December sometime. So yeah, I mean it's not the best situation right now to be in for a country, but what can you do, right? Thanksgiving is a major national holiday, and people flew. And if people flew in a plane for like 6 hours without an N95 mask, and if somebody in the plane had COVID and started coughing all over the plane, then you could get it even if you are wearing a mask because it's airborne precautions. So probably out of all the people who flew, you'll probably have a few 100,000 infections. I think that's to be expected. You may even have up to like 500,000 infections from among the people who flew, just among the people who flew. Um, it's possible, but certainly probably over 100,000, hundreds of thousands of cases of infection probably will show itself in the next few weeks. Um, that's why, if you're going to fly, make sure you get an N95 mask and make sure that it's airtight, and wear that for your whole flight. Don't take it off. You know, yeah. So, when COVID-19 is airborne, it's not that hard to get it. Even if you're wearing a mask, you can get it. So that's something you have to worry about if you're flying with, like, say, 200 people on a plane. It's definitely a matter of worry. So, obviously, all the hospitals will be packed in December. Um, and I'm predicting that Virginia Hospital Center, Innova Fairfax Hospital, MedStar Georgetown Hospital, MedStar Washington Hospital Center, um, Children's National Hospital, um, Suburban Hospital in Maryland, Montgomery County, and Sibley Hospital in Washington, D.C. will be packed in end of November or beginning of December. It will overflow. And I'm predicting that at least 12 nurses will die from COVID-19. In every one of these hospitals, you have 12 nurses dying minimum before Christmas 2020. Because when you have 10,000 people dying every day, some point in December, you can imagine how many nurses are going to get COVID, and some of them will die. Yeah, so that's coming. Um, Lion is just, Leo the lion is just like looking. I don't know what he's thinking, but he's looking. Yeah, but it is Christmas season. We celebrate Christmas. We celebrate with Santa, and I put up my decorations, and I put up like a Christmas light as well, and I go one of those blow up Santa and blow up snow man, you know, Frosty the Snowman. You plug them in and then they blow them up. That's really cool. I mean, like gives you cheer. If you're a mother or father, you should get a few of those. Not just for outside of the house, but inside of the house where your children are. Because I think the kids, it's kind of like the bouncy castle, but it's kind of like it's not a bouncy castle. You just look at it, but children can go and hug it, or they can stand next to it. You can take photos with them, and you can make a Christmas wonderland inside your home. If you have a big house, you can do it better. You could like kind of like feel like Charlie the Chocolate Factory. You can make your whole house into like a winter wonderland or Christmas wonderland, and you get your children involved. It could be like a fun family activity, and it'll be something memorable for them. Your children, if they don't have COVID, they'll remember that for the rest of your life. Don't treat this season like any other season. Do something special inside your home. Have activities that engage your children, decorating every room in your house with Christmas theme. Children will remember that, especially if you do video camera. Um, if you're a parent, you could do like Christmas skits with your children. Using the Bible. Do fun stuff with your children. You could videotape it. You could even submit it to YouTube. You have your family production of Christmas plays that your children put on. They could put it up in YouTube, you know, for share with other families that could cheer them up. You know, so be creative with what you do during Christmas time. Have fun with it. Um, think of this as a blessing that you can spend time with your children. You could do things with them you would not be able to do otherwise. So maximize the opportunity. See how nice it is if you're already married. If you're single, you're out of luck. How are you gonna do like Christmas plays with by yourself? I guess you could do a Christmas monologue. Or like radio, you could like do different voices and read it. And but it's hard to do it on YouTube because it's like you just by yourself. It could be entertaining watching one person sitting and doing different voices or like a Christmas pageant or play. I mean, that could be entertaining. Um, yeah. So the second article is um, I guess we didn't finish reading the first article, right? I got so involved with the Christmas, idea. Yeah, so we should read the whole article, right? Uh, do we read the whole article? I guess we have read the whole article. We come to think about it, but yeah. So let me just read the last sentence again because it's significant. Case numbers have been rising across the U.S. in recent weeks, and healthcare workers are reported to be exhausted and stressed as hospitals and intensive care unit beds fill. You got to remember, nurses are not robots; they're going to burn out. We have 6 more months of flu season to go. We have November, December, January, February, March, April, May, June, July, June. So you have like 6 to 8 months to go to June. Um, a lot of nurses are going to die, from now until then. I'm predicting like up to 10,000 nurses or more may die by Christmas. If you have 10,000 people dying every day, you could have 10,000 nurses die by Christmas. So you can imagine how many nurses will die by June 2021. So nurses are not God. Nurses are not super, Superman, right? Um, so you're gonna have nurses burn out, and so you're looking at a really horrific scenario in the coming weeks. In December, you're gonna see some horrific stuff happen because nurses are burning out, nurses are dying of COVID. So December will be very tragic. So it's kind of sad, when you think about it. But it's what it is. It's COVID-19. It's a global pandemic. These things are expected in COVID world. If you survive COVID by Christmas, have yourself a Merry Christmas. I don't think nurses should be flying home for Christmas. Um, because it's too dangerous, Even if you wear a N95 mask, it's only 95% foolproof, and you're gonna take off your mask to drink a cup of water or eat a food item and get COVID. You know what I mean? I think hospitals should pass a rule saying no nurses should fly for Christmas or should fly at all. And if you're a nurse who flies, you need to take 14 days off and quarantine. I think that should be an official part of every hospital's policy because you're going to have nurses burn out and get COVID anyway. You don't need to increase the jeopardy and danger for nurses by letting nurses who flew work in a hospital without 14 days of self-isolation or quarantine. Because other nurses' lives are going to be in danger, doctors' lives are going to be in danger, patients' lives can be in danger. So I think every nurse who flies should be required to quarantine for 14 days and have a negative COVID-19 test in the beginning of the quarantine period and the end of the quarantine period, officially, to be able to come back onto work. I think hospitals have to be serious about dealing with COVID because we have 6 more months of flu season to go. If you loosey-goosey with letting nurses fly in a plane, we're not going to make it to like March as a nation. So think about every hospital having nurses who fly for holidays, for Thanksgiving or Christmas, and they don't self-quarantine. I mean, you can't you can't create nurses out of nothing, right? If they get sick and die of COVID, that's it. Um, Yeah. So that's why, if you're a chief nursing officer or chief medical officer or CEO of a hospital, I think you must pass a policy saying no nurses should fly in a plane. And if you do fly in a plane, you have to take a PTO for 2 weeks, um, and self quarantine, personal paid time off. I think that has to be required. Because obviously, if you require nurses not to fly, um, then they can fly. I mean, they could drive to wherever they want because if you're inside your car, you're safe, right? Because you control the factors. But when you fly, you can't control the factors. So if you pass a rule saying no nurses can fly, unless you're willing to take two weeks of PTO, personal paid time off, to self quarantine afterwards. I think that's fair. Or take sick leave to self quarantine or whatever. Hospital can set a policy, mixture of PTO and sick leave days, or saved up PTO days. Because when you think about it, think about it. Let's say there are 50 nurses who flew for Thanksgiving and come back from Thanksgiving and they don't self quarantine and come into the hospital. And there are 1,000 nurses in the hospital. 50 nurses, out of them, maybe 20 had COVID, unbeknownst to them, and they're like spreading it everywhere. And by the time you catch it, maybe 100 or 200 nurses got infected, or doctors, and so that hospital can become permanently crippled for weeks. So I'm just looking out for your hospitals out there and nurses out there. It helps everyone to self quarantine for 2 weeks after flying anywhere. And I think hospitals have to be strict about that. And after all, nurses are leaders. If nurses don't practice leadership in COVID-19 America, the country is lost, right? So hospitals have to set an example with their own employees, like nurses, doctors, nursing assistants, whoever, by making sure that they self quarantine if they fly, anywhere. Self quarantine for 2 weeks to protect, not only to protect the workers, but to set an example of how we can get out of this COVID-19, reduce, reducing the death, right? And it seems why I submitted a policy paper proposal for American Nurses Association ANA annual kind of conference. Because see, so I have these ideas that will help reduce COVID-19 death in your hospital, in your town, your county, like Arlington County, city of Alexandria, Falls Church City, Fairfax County. See, I have these ideas that reduce COVID-19 death. Because the important thing is, like, if nurses get COVID and die, and nursing stuff is reduced, there's higher chance that patients with COVID will die. Because nurses are stretched too thin. So there's a domino effect. In terms of uh, drastically increasing percentage of COVID-19 patients who die, who could have survived if you have 100% of nurses intact. But if you get 20% of the nurses wiped out through infections, and you're operating at 80% of nursing staff, then of course your death rate in the hospital of COVID patients can go up from 5% of COVID patients to 20% of COVID patients can die. This is expected because nobody's God, right? Everybody's human being. There's so much you can do, right? Um, so I'm just trying to watch out for you. Uh, so this is why I'm the Leonardo da Vinci of 21st century. I think about things that you don't think about, and I have actionable game plan to save lives, right? That's what you need. You need an actionable game plan, right? If you're a chief nursing officer, you could put into place a policy saying all nurses are forbidden to fly in a plane. Uh, and if you do, or nurses are not allowed to fly in the plane without, or nurses who fly in the plane must take their personal time off, PTO or sick leave, to quarantine for 2 weeks before coming back to work. I mean, if you're generous, you could obviously say you can fly. We'll give you 2 weeks free. You know, I mean, your hospital can set the policy you want. But the important thing is, any nurse who flew in a plane, you should require them to self-quarantine for 2 weeks. That's like, I mean, we're talking about a global pandemic here. If you don't do simple things like that, there's no way you're going to prevent COVID-19 deaths in your town, your county, in your city. How are you going to prevent it if you don't do basic things that you need to do? You know, um, yeah. So you understand why I'm the Leonardo da Vinci of 21st century. Why this show is absolutely necessary, right? You understand that. Second article is near crisis. Some hospitals face tough decisions in caring for floods of patients. Floods of patients. You know, snow. Frosty the Snowman is like floods of patients. It's shocking. I'm thinking about it. When you think it's shocking, floods of patients, the concept is shocking, but it's true though. You see what I'm saying? So, so the important quote there is hospitals in some of the hardest hit states are exhausting every healthcare worker, hospital rooms, and pieces of equipment to evade the worst case scenario when care may have to be rationed. Care may have to be rationed. Can you imagine that? It's like rationing food, but you're rationing like nursing care. Can you imagine what will happen when nursing care is rationed? Can you imagine the spiking of death just because of that factor? This is why I'm saying there will be minimum 10% death of everyone who gets infected in the next 6 months. If a million people get infected, 100,000 will necessarily die because there are all these factors that are converging and will blow up all at once. So you're going to have probably, at times, you're going to have 20% death of all cases. Like if you have a million people infected, 200,000 will die. And it will average out to 10% death over the flu season. Yeah. It's simple math, people. Right? It's nothing complicated. So in a sense, I'm being like a Santa Claus in giving you opportunity to save a life, right? Because if you listen to my advice, you can actually save lives. Instead of going to 20% death, where out of the 100,000 people who get infected, 200,000 die, only 10% die, which would mean 100,000 die, which means you save 100,000 lives. So in a sense, I'm a Santa Claus to give you these actionable advice. You need actionable advice to save people's lives, right? You can't just have theories, right? You need actionable advice. And I'm giving you actionable advice. Require all nurses who flew in a plane during Thanksgiving to self-quarantine for 2 weeks. That's an actionable advice to make sure you protect your nursing staff, right? Hopefully you will heed it, because that's just very good advice. Um, let's continue on. Many states are warning they're on the brink. On the ground, equipment and staff shortages are already straining the system and changing how hospitals provide care. An NPR data analysis supports what healthcare leaders and researchers have cautioned. This stress may even be contributing to higher death rates. Of course it's contributing to higher death rates. Of course it is. What do you mean maybe? I mean, it's like science, when you're rationing care, people are going to die in larger numbers. If you lose 20% of your nursing staff because you had a flood of people who flew during Thanksgiving work and they infect other nurses, how are you going to operate your hospital? Of course more people are going to die. That's like expected. You see what I'm saying? So what you need to watch out for in the next week is many nurses getting infected with COVID from the co-workers who flew in a plane for Thanksgiving. That's what you're looking at right now. Third article, U.S. counts 13 million COVID-19 cases. It's 4 million milestone of November. They had like million cases 4 times. So 4 million cases basically. Yeah, so the quote is, The US reached 13 million diagnosed cases of COVID-19 on Friday, another milestone in a month riddled with them. It was the fourth such marker the country has counted in November, which has seen 3.8 million cases of coronavirus. The US is on pace to tally more than 4 million cases this month alone. Um, and it takes time for people to die. So out of those 4 million, you could have 10% death rate, 400,000 people can die. So you can imagine if 10,000 people are dying every day in December, in 30-day period, 300,000 people die. Do you see how that works out? You could have more than 15,000 people die in a day. You could have more than 20,000 people die in a day. So you can see how that 10% death rate can hit over the flu season. So more than doubling the previous record of 1.9 million cases set in October. Yeah. Um, so cases are going up. People are getting sicker. And flu season is going to take more people's lives, because people are sicker during flu season compared to summer. So we're looking at serious problem heading into December. We're several days off from December. So you'll see what happens next week and week after that. There will be a new crisis in hospital because many hospitals are now requiring nurses to quarantine for 14 days after flying for Thanksgiving. So you're going to have hospitals after a couple of weeks operating at like 90% capacity, 80% capacity. Some will operate at 70% capacity based on how many nurses flew in a plane. And how many of them got COVID or were asymptomatic for passing on COVID to other healthcare workers in their hospital. Yeah, so it's just going to be tragic. I mean, you gotta think of all the potential crisis points, right? You cannot just wait for the crisis to happen and try to solve it. You gotta try to prevent it. This is why I'm calling on all chief nursing officers to require every nurse who flies in a plane to take 2 weeks off of self-quarantining before returning to work. You have to protect the nurses who are healthy. It's absolutely necessary. And how you do that is up to each and individual hospital. You could have, you can have, you can have, people required to take PTO if they choose to fly, or personal pay time off, or sick day off, or not. I mean, you can choose that, but you cannot have nurses who flew in a plane returning to work before 2 weeks of self-isolation or self-quarantine. I mean, you got to protect healthy nurses. I think I'm just saying something that's logical here, and that's in alignment with nursing practice, nursing care, nursing science, evidence-based research. So I don't think I'm saying anything that should not be said. And I think that we need to apply our nursing research, evidence-based nursing research, in our nursing areas. You see why the clinical nurse leader, this is what clinical nurse leaders do. We use evidence-based research and bring our research to the hospital at the unit level to ensure that there's safe practice of nursing going on, right? It's not safe when you allow nurses who flew for Thanksgiving to return to work before 12 weeks of quarantining. It's not safe. You see what I'm saying? And so I am all about safety here. And that's why I am a clinical nurse leader. That's our job. That's in our scope of practice, to use our evidence-based research to protect safety in nursing units. You see what I'm doing here? So this show is a public service to everyone in Arlington and Virginia's 8th District for sure, but not just here, but around the world. Because English people watching this show, like Boris Johnson, can watch this show and can mandate that every nurse who flies must take 2 weeks off to self-quarantine before returning to hospital. Because you don't want nurses to die in large numbers by horizontal infections from other nurses who flew during Christmas or Thanksgiving. You see what I'm saying? Um, you have to protect your frontline workers, or you're not going to get to June. You know, you cannot like 50% of everyone who gets COVID die in your country if your frontline workers are like dead. You know what I mean? Um, you have to think seriously about this. What if there's like, if you send the Marines and like, 50% of them die, and then you send in the army and 50% of them die, how are you going to win the war? You see what I'm saying? You got to make sure you protect. I mean, there are risks, but you have to protect as much as you can, right? And same thing with our nursing staff in hospitals. You have to protect healthy nurses. And the only way you're going to do that is require nurses who flew in a plane compromised with 200 passengers. Obviously, there's a compromise to quarantine for 2 weeks, have a negative COVID test before return to work. You have to be serious about this, or we're not going to make it to June. You know, you see why I'm the Leonardo da Vinci of 21st century? Did you hear Dr. Fauci talk about this? Did you hear Dr. Hahn of FDA talk about this? Did you hear Dr. Redfield of Center for Disease Control talk about this? Did you hear the director of NIH, National Institutes of Health, talk about this? Did you hear Dr. Sanjay Gupta talk about this? Did you hear Bill Gates? Oh, he's a genius, but did you hear him talk about this? Did you hear Dr. Gottlieb talk about this? No. Did you see why I'm the Leonardo da Vinci of 21st century? I think of things that no one else does, right? Knowledge is power. Idea is the currency of 21st century. It's more valuable than oil. It's more valuable than internet. Um, Knowledge, information is everything. Countries rise and fall on information, right? This is why I am the Leonardo da Vinci of 21st century. And this is why this show can save you, your hospital, your community. So keep watching this show every day because you're not going to get the kind of expert analysis that's going to be relevant for you and your hospital, your community, your city, your town that you get here from anywhere else. That's why you need to watch this show every day. If you're a policymaker, it's more important that you watch this show every day. You need ideas to protect your community. Well, you're gonna like walk in the blind, walk in the dark. Yeah. So you need guidance. You need light, right? So or you may encounter an emergency situation, in your town or in your hospital, from which you cannot escape. I mean, we don't want whole towns to die. I mean, we don't want to read in your article this town of 150 people, everyone died from COVID because nurses all died. And we don't want to read about these things, we don't want these things to happen. That's what I'm saying. It can happen. We need to protect healthy nurses in every hospital, every healthcare center. We need to be serious about policies we take to protect the lives of nurses from COVID infection. Very important. I hope that you will be well and that your family will be well. And I'll look forward to seeing you tomorrow. As you know, this is a daily show. Yeah, tune in tomorrow. See you tomorrow. Bye.